Hello, New York City. My name is James, and this is Free Soap Presents Da News for Saturday, May 23rd. We're nearing 6 months globally and 3 months locally of the COVID-19 pandemic, and the purpose of this missive is to provide information on recent developments concerning COVID-19 in New York City, specifically contact tracing and risk mitigation, to ask questions, to share resources, and to highlight the work being done in our city. Currently, the reproduction value for COVID in New York State is 0.8. This means that for every 10 people with the virus, only 8 people are being infected from them. This is good. It means our actions are mitigating spread and that the numbers are going down. And as long as the R value stays below 1, the numbers will continue to go down. And to maintain the decline of the virus while easing the restrictions being placed on our movements, New York State and New York City have begun contact tracing initiatives. Contact tracing is a tool humanity has developed for decades to combat epidemics and pandemics, notably Ebola outbreaks in the past decade. The New York City program will be platformed by communications company Twilio, it has just been announced. And while we have been aware of this virus for 6 months, the New York City program was launched 2 or 3 weeks ago. The program seeks to employ 2,500 contact tracers, currently has hired at least 500, and has a plan to employ 1,000 by June 1st. For context, Wuhan, a city of 11 million, had a team of 9,000 tracers to contain the outbreak, roughly 3 times our eventual goal, and 9 to 14 times our current capacity per capita. Ethiopia conducted a door-to-door survey of its capital, Addis Ababa, and its estimated 7 million inhabitants, beginning around a month ago. Ethiopia has reported 5 deaths as a country. New York City has just crossed 16,000. So what is contact tracing? Why is it important? And how can we continue to mitigate our risk while we attempt to eradicate this virus? Contact tracing involves interviewing people who are sick with the virus about their actions during their infectious period, which begins 2 days before the onset of symptoms. Using this information, they determine who the infected person has been around, and thus who we believe to be at risk of contagion. By tracing these contacts and informing them as soon as possible of their need to quarantine, we can reduce the spread and bring the R value closer to 0. So I know we've all been cooped up for a while, and many are out of work. In a city with 1.5 million hungry and hundreds of thousands unhoused or with unstable housing, extreme public health emergencies hit us hard. We have underdeveloped infrastructure, ill-equipped social welfare and public health systems, and a white supremacist criminal organization controlling the presidency whose intentional mishandling of the pandemic is indistinguishable from genocide. So we have been extremely disadvantaged by our circumstances and thus have had to take up many practices to prevent the spread of the virus. We're wearing masks, we're keeping physical distance from others, we're washing our hands and not touching our face, we're restricting our interactions and isolating and quarantining if we are infected or exposed. This system of precautions has been compared to an abstinence-only sex education as opposed to a safety-informed approach, kind of as an analogy. And I personally think a lot of this, our sort of abstinence-only approach, has to do with the fact that we live in a punitive carceral system, and thus governance is seen as an infringement upon our liberties. So we think in a model of restricted or unrestricted freedoms rather than a model of our duties to our respective municipalities and a consensus among neighbors to keep each other safe. What has been proposed now that we are on the other side of the pandemic, or at least a period of downswing, is an informed approach that understands risk as a spectrum. This work is being done by epidemiologists Julia Marcus and Ellie Murray from Harvard and BU School of Public Health, respectively. They've created this graphic, which shows various stages of risk from staying inside with family up to gathering in groups. I found this through the Twitter of New York City Council member and chair of the council's health committee, Mark Levine. So, as you continue into the future and start to give in to the desire to see others, to be outside, to enjoy yourself in riskier situations, think about that risk as on a spectrum. If you're going to be close to others, do it outside, do it with a mask on. If you're going to be inside with others, keep your distance, keep a mask on, wash your hands frequently, and don't touch your face. You don't have to take every precaution every second of the day, but when you are increasing your risk, you should be increasing your adherence to precautions. So this methodology also leads me to some questions. I wonder, what is the risk of having someone over to my place? Which I would be much more comfortable to do had we a robust contact tracing program in place. I wonder how much we will be able to spread out in the city, just numbers-wise, based on our density and the availability of public space. I wonder how we can use the subway safely when we consider that this 6-foot rule isn't going to cut it with our current infrastructure. And I'll keep wondering, and if I come across some answers, I'll try to inform you. Mutual aid networks are bolstering their ranks, ramping up their activities, and reaching more people than ever in our city. If you're working with a mutual aid network or any organization providing assistance, please reach out to me. I'd love to hear about your work and report on it to others in the city. I'd like to shout out Yuli New, a state assembly member who has been kicking ass with mutual aid for her constituency. She's been working with 46 Mott Street to make meals for community members, late shift healthcare workers who don't have access to nutritious foods at the time of their shifts, and the elderly. She's really activated a community network, even with the obstacles of largely only being able to connect virtually. If your representatives are doing the work and in need of some recognition, please reach out to me and I will shout them out on the next news update. I want to take a moment to share the memorial that Make the Road New York, a justice organization, has had this week for members that they have lost due to the pandemic. Names were projected big and tall for all to see on the side of a building and were read aloud by attendees, respecting physical distance and wearing masks. It was a beautiful way to remember and mourn the dead, and in the age of physical distancing, inventive solutions are needed to address our grief and allow us to mourn together in what is going to be a long period of mourning for our communities. May all the fallen rest in peace and rest in power, and may they rest knowing that the work goes on, that the fight is being fought. Thank you to all those who continue to walk the path. To bring it back to our boring and ineffectual state and local governments, shout out to the City Council for holding a hearing on the NYC DOC with the borough DAs, except for Cy Vance. My takeaway from the hearing is that the DOC is covering their ass, and that if Tiffany Caban had won instead of Melinda Katz, less people would be dead right now. The council also held a hearing with high school students on the city's proposed budget. These young people have rightly pointed out that the budget is incredibly fucked up. The New York Police Department is being given more than hospitals, homeless service, youth services, and housing combined. Thanks to the council members who are exposing our local government's abject failures to provide for our city. Love y'all. On the state level, we have a Republican governor pretending to be a Democrat who is slashing every budget item for next year while refusing to tax the rich. We love to see it. And federally, the executive branch is killing us on purpose, and the legislature is composed of 2 right-wing parties who pass right-wing chicken shit legislation that has hollowed out America's competency and sold us wholesale to the interests of billionaires. My message for y'all is this: trust no bitch. It is incumbent upon New Yorkers to keep each other informed. Thanks for watching. I hope to talk to you soon. Much love, James.